Good morning. Welcome to Your Health Matters. My name is Carl Sterling. I'll be your host. It's always great to be here. And we're a longevity focused program. And as is my clinic, a longevity focused clinic. My goal with this program is to bring you top notch education and information, the best information, education from the top notch experts in the field. Normally, we have a few things we go through at the beginning of a show, kind of a ritual, but I have a special guest with me on today, and I don't want to waste any time. So the only thing we're going to talk about today, it's a part of our weekly ritual, is the book of the week. This week's book of the week is entitled Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. And folks, you've heard me say it before. We need a lot of truth out there. We need information that's going to guide us, to help us increase the health span within our lifespan. And there aren't many books that I talk about in a way that I just say you absolutely must, absolutely must, absolutely must have to get it, buy it, read it, digest it. But this is one of those books. And I'm honored to have the author with me today. His name is Dr. Marty Makary. Dr. Makary, you are associated with, Johns Hopkins University. This book is a masterpiece. You're telling things about the medical world, at both sides of the coin. Like you say, a lot of times there are great, great people in the medical world. A lot of doctors, medical professionals. They want to do the right things. And it seems that there's a system that's just all complicated and sort of broken here and there are procedures happening that probably don't need to happen often. There's an epidemic of maybe over-medicated people, over-medicated society. So I was wondering if we might even start with right there is, what's your view on what's happening overall right now in this country, maybe in the world, with the system in general? And thanks for
Well,
joining me, and welcome.
yeah, no, Carl, look, great to get to know you a little bit here before the show, and thanks for your work educating folks, and thanks for your work in rehabilitation. So our country is not doing well at all. If you look at our country compared to other countries, we've got an epidemic that some other countries are not dealing with. Half of our nation's children are obese or overweight. 3% of children in Japan are obese or overweight. We have a poison food supply. It's making people sick. And then we medicate people, and we call this our healthcare system. We're busy billing and coding and measuring throughput as the country gets sicker and sicker each year. And I'm not just talking about obesity, I'm talking about diabetes. Autoimmune diseases have been skyrocketing. Why? 1 in 5 women now will get an autoimmune disease. Autism has gone up 14% each year for the last 23 consecutive years. Why? In my field of pancreatic diseases, pancreatic cancer has doubled in the last 2 decades. Why? Cancer rates doubling? Who's working on these giant tectonic trends that are uniquely American? They're associated with the Western diet. They're associated with the modern era. Just one living generation ago, you never saw peanut allergies. Why are we dealing with an epidemic of peanut allergies? So it turns out there's a lot of very good new scientific research that has been done that speaks to these very issues, but it's just not mainstream. It's just not cracked the main silos of traditional academic modern medicine. And as a result, this new information, which is scientifically sound and medically revolutionary, has lived in the blind spots of modern medicine. And
Mm.
that's why I wanted to write this book, to educate people.
It's amazing. I've been reading through things, and I've been watching you online here with some interviews you've done over the past few weeks and months. I find it disturbing and interesting at the same time how there's so many, let's say, broken communication pathways. And then and I'm talking professional to professional a lot of times. As another guest said a few weeks ago, I had on to get you in the system. And if you're younger, it's better because that means they make more money off of you throughout your lifetime, meaning the system is, let's say, big pharma. So we can give you the insulin, give you the drugs, give you this. And then if you have type 2 diabetes, you're like probably going to have four other comorbidities with it on average. So you're going to have all kinds of specialists and medications, yet the communication between them doesn't seem to be happening very well. We know it does happen. It's just not happening as often as it should, it seems. And I have to wonder sometimes, well, why is this? Why is there that breakdown? And what parts of the puzzle play a role? Is it insurance? Is it, well, I'm going to ask if it's
Now,
insurance or the medical world itself. How does that work?
look, I think I love being a doctor. I love working at Johns Hopkins as a surgeon and public
Hmm.
health researcher. And I think we've got good people in medicine. Everyone I've ever met has been attracted to the field out of a sense of compassion. It's a
Right.
calling. It's beautiful. You, me, everyone we know. But here's what we have. We have good people working in a bad system. And it's not a system we designed, it's a system we inherited. And we're so busy focusing on our business models and throughput and billing and coding and keeping the administrators happy and appealing to corporate medicine that we've lost sight of health. We're just so focused on the late stages of playing whack-a-mole. And I think personally, Carl, we've done a terrible thing to health professionals in the United States. We've done a terrible thing to doctors. We've told them, put your heads down, focus in a specialty. We value specialties more. And then focus on billing and coding. We're going to measure you by your throughput. And if you have a big idea, we don't give doctors the time or resources to pursue them. We don't have research to support that. And so we've done a terrible thing by not giving doctors the time and resources to talk about the root causes of so many of these skyrocketing health conditions. It used to be that a pediatrician would maybe once in their career take care of a young child with type 2 diabetes. Now, 1 in 3 children born today will go on to have type 2 diabetes or prediabetes at
Yeah.
some point, right? So we have got this epidemic. And what have we done to physicians and others? We've said, put your head down and focus on medicating, on doing surgery. I've been it. Look, I'm a surgeon at Hopkins. I can tell you, you show up, you have big ideas, those ideas are kind of crushed and you're told, hey, we're looking at your monthly numbers and here's where you stand. And good job, you're above the average or you're bringing in a lot of money. Uh,
Hmm.
and so what we have is not a healthcare system, but a billing financial model system that profits on sickness, not because anyone's diabolical, but because nobody is thinking about the big picture.
Yeah, that right there is that's a great way to put it. I think we're close to a first break here. When we come back, I'd like to talk a little bit more about this billing situation. And more specifically, if I'm correct, hospitals, let's say, a lot of them, they'll have agreements with up to, maybe hundreds or even thousands of insurance providers. And I think, I forget what they were referred to, but it's a special contract. And I know you know what I'm talking about.
Yeah.
So let's go out to a break here. You're listening to Your Health Matters. My guest today is Dr. Marty Makary. His new book is called Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. It's a game changer book. It's an eye opener. I appreciate you writing this. We'll be back after this short message. Okay, we are back with Dr. Marty Makary. And Doctor, we left off here talking about insurance, hospitals, billing. Can you enlighten us? as to the, let's say, the level of transparency that's out there, or lack of transparency when it comes to billing, what the cost of things is. That's one thing that blows me away is you can go have a baby for $4,000, or you can go have one for, $40,000. Depends upon where you have the baby. And the care isn't 10 times better. Maybe it's not better at all at the $40,000 hospital. Tell us about this, please.
Yeah, so we have marketplaces that are dysfunctional in healthcare. That's one of the primary problems. They're competing, the hospitals are competing, but they're not competing on price and quality. They're competing on NFL ads and valet parking.
Yep.
And so what we need is healthy competition in healthcare. And that means we need more transparency on price and quality includes the appropriateness of care, not just complication rates. So my team has led an advocacy effort, which was able to get an executive order signed by the White House. It was bipartisan to require hospitals to post cash prices for common shoppable services. There's no reason you should get the runaround when you come into the hospital and you say, I'd like to know how much this is before I have it done when it's a non-emergent service. So we are starting to see that information become available. Third-party companies are scraping that information to make it easy to understand and usable on websites and apps. But it's really trying to address one of the bigger problems in society, and that is where is the accountability for our nation's hospitals when they engage in price gouging and predatory billing, which is exactly what you would call some of these practices that are going on today. When a pilot flies a plane, they don't tell you, oh, we can't give you a price for the flight, right? Oh, we just don't know. And it depends on the weather and our staffing and fuel prices. And we don't know if you're going to consume a beverage. No, they give you a set price, and it sort of is based on a mathematical model that factors in all that stuff, all that variability. And pilots don't spend half an hour when they land the plane coding and creating a bill based on the complexity of how hard they worked when they said, no,
Mhm.
they have, it's an efficient marketplace. And we need more of that in healthcare. And when we just uncover the fact that some hospitals sue patients who can't afford to pay, sue them in court to garnish their wages.
Mhm.
In one town, they sued half the town, our research found. In another town, they sued the small town judge by accident. Um, we look, there's when hospitals were designed, they were designed to be a safe haven, a refuge for the sick and injured. Many were started by churches or philanthropists, and they had an incredible mission. And we need to recognize that incredible heritage that we have in medicine. We have a duty to uphold fairness and being reasonable and compassionate in every aspect of the care at the hospital.
I'll tell you, first of all, I like the airplane, that analogy, because if they could do that, I mean, I don't know, they could send you a bill for thousands of dollars for a trip from New York to Chicago or something, right?
Yeah, they'd be price gouging.
Yeah, for sure. And there seems to be quite a lot of gouging going on here and there. Now, I didn't think of this on my own. I'm not that smart, but I did hear you talk about in the veterinary field. This subject came up in another interview. That's an interesting situation there when they take the animal back. And I don't want to go off too far from what we're really focusing on, which is human health and human health care, but there seems to be a lack of transparency there as well. But it's happening to humans as well. We don't know what we're going to be paying.
People are coming to us as doctors and health professionals at a time when they're vulnerable. They're
Yeah.
coming to us in earnest for help. And for a hospital to take advantage of someone, to have them sign a financial disclosure form or a financial commitment when they are in excruciating pain, to
Yeah.
sign your life, home, mortgage, savings away under penalty of law. Sign here. You must sign. No, you don't have to sign if you're in an emergent situation. Law requires hospitals in America to take care of anyone who's has an emergency or urgent condition, and you don't have to sign your financial life away. And unless they give me a price for something I'm asking about, I don't sign.
Mhm. Interesting. Well, I'm curious to know when it comes to let's go down a specific path here for a minute. This is a little bit different because we've been talking insurance pricing. Well, let's talk about let's say the over medication, over medicated situation that we're dealing with. It seems to me the pills are doled out more than, let's say, they need to be. And I'm no doctor, I'm not an MD, but I work with them all the time. I have their patients come in here every day. There's an over medication crisis too. And what's the driver behind that? What's happening?
Well, look, I think doctors are forced to see patients in short visits. Some patients come in now with expectations that they want an antibiotic for a little sniffles or something. I saw it during COVID. Low
Yeah,
risk people were demanding Paxlovid. A
yeah,
year after the Paxlovid push to treat COVID, the study came out in the New England Journal of Medicine that there was no benefit in low risk individuals, zero. It actually prolonged illness for some of those individuals.
wow.
So we see this intense consumerist culture. Can't even watch TV sometimes now with all two or three ads in a commercial break being for IV infusion biologic drugs. And that's because they're super expensive. We have the most over medicated population in the history of the world. Who is working on why do we need these drugs? What's going on? We have engineered highly processed foods with additive chemicals.
Yeah.
We have 1,000 chemicals in the American food supply that have been banned in Europe and Canada. What's going on here? And the body is reacting. When you introduce things that do not appear in nature, in the gut, the body's immune system that is deeply embedded in the wall of the intestine, that immune system reacts. Um, and it doesn't react with a big inflammatory storm. It reacts with a low grade inflammation, an inflammatory response that is sort of chronic and generalized, and it's throughout your body. And it makes people feel sick. People feel low energy. Kids don't want to pay attention in the afternoon after eating the school lunches. So we've got to start talking about pesticides, seed oils, microplastics, and all
Oh,
these banned food additives, including food colorings.
oh, absolutely. Boy, I could go off on that one for a while. I'll just say this. Back a few years ago, I was a control subject at Hershey Penn State. That's where my son did his PhD and his MD before he went to Emory for residency. So, Dr. Shumei Wong, it's a wonderful neurologist. I just love her. She needed a person, a male, who had never welded before. And then for another study, a male who had never been a pesticide applicator of paraquat for a living. And of course, as you well know, and we've talked about on the show a couple of times with other guests, other experts, paraquat is still allowed here, still being sprayed. Crop dusters are dusting Western New York, where I'm at, and probably right around me. I don't even know. There have been lawsuits about this. There's been all kinds of things, studies on this. But we know going back years and years and years, paraquat is doing a lot to hurt us. In
Yeah.
addition to Roundup, in addition to, like you say, there's so many other chemicals. I forget the one they use in dry cleaning too, the tritetrachloride or something like that is really horrible. With that said, I'm talking too much. Radio minutes are the fastest minutes in my life. We have to go to a break. When we come back, folks, we'll continue with Dr. Marty Makary talking about his new book called Blind Spots. An amazing, amazing book. We'll be back after this short message. Okay, folks, we are back with Dr. Marty Makary. We started to talk a little bit about gut biome. Now, we've had other people on the show and we've talked about this. But would you mind telling a little bit more about this? Because everything starts with what we put into our bodies, whether we're breathing it, putting it on our skin, drinking it, eating it, our body's going to be affected. I'd love to learn more about the gut biome and how that starts this process. of everything good or bad?
Yeah, so the microbiome is the lining of the intestine of bacteria, and it's millions of different bacteria from all the way through the gastrointestinal tract, and they live in a balance. These different bacteria are all have a job. They're involved in digestion. They train and stimulate the immune system in the gut. Some of these bacteria produce important vitamins and hormones like serotonin, which is why the microbiome is involved in mood and mental health. And some of the bacteria make GLP-1, the active ingredient in Ozempic. So these bacteria are an important organ system connected to almost every part of the body through the interactions. But yet it's lived in a blind spot of modern medicine. There's no department for the microbiome, even though it's central to health. Doctors don't talk about the microbiome, even though imbalances in the microbiome drive general body inflammation, which is at the root cause of many of our chronic diseases. And alterations in the microbiome have recently been associated with mental illness and different mood disorders, even cancer.
Mhm.
So we have to understand that this is an important part of the body to take care of. Just like we take care of our muscles with working out, we need to promote good gut health of the microbiome. That means avoid unnecessary antibiotics, which carpet bomb the microbiome, and then it changes the composition. A
Yeah.
study out of Mayo Clinic just found if you give somebody antibiotics in the first or in the early years of childhood, when that microbiome is still forming, the child will go on to have a 20% higher rate of obesity and a 32% higher rate of attention deficit disorder
Oh
because of the
man.
alterations in the microbiome, presumably.
Yeah.
90% higher rates of asthma and nearly a 300% higher rate of celiac. Altering the microbiome has direct consequences. And when a baby has a C-section, and again, antibiotics and C-sections save lives, but many of them are unnecessary. 60% of antibiotics are unnecessary, and we all know when, and 40% of C-sections. Well, when a baby is born by a C-section, they're not getting the same microbiome because
Yeah.
in utero, when a baby's in the mom, the gut is sterile. There's no bacteria in their gut. The microbiome is seeded from the bacteria in the birth canal when the baby passes. But when a baby is born by C-section, a baby is extracted from a sterile operative field. And what may seed that baby's gut are not the bacteria from the vaginal canal, but the bacteria that normally live in the hospital and different
Mhm.
bacteria. And if they
Wow.
don't breastfeed, it also changes the microbiome. So we need to also look at the food supply. If pesticides are killing pests, what do you think they are doing to the microbiome, the
Yeah.
garden of millions of bacteria in the gut? So when people think eating organic is not worth the extra money, look at the cost of chronic diseases. And it's especially important to buy organic when you're eating the surface of a fruit or vegetable.
Yeah. Well, that brings up many good points. For example, somehow we're going to pay, possibly. We either pay now to eat well or pay later, and it usually costs a whole lot more to be sick. And I'm not just talking about finances or financial aspect is there's the emotional, the mental, the physical, and maybe the drain on those around you if you need assistance, if you need a caregiver. And of course, in my clinic, working with movement disorders, people with neurological movement, dementia, Alzheimer's, we're seeing caregivers every day. And a lot of them are pretty stressed out. They're low energy. The demand is very, very high. I There's a quote I often say, I actually made it up all by myself. One of the few things I ever thought of, which is I tend to be self-deprecating here and there, but I kind of enjoy that, is whose burden do you want to be? I wasn't taking care of myself. And 15 years ago, I was close to 300 pounds. I'm 6'2". I'm not supposed to weigh that much. Former drummer for a living, drank way too much, ate way too much, didn't move enough. Well, I paid that price. Fortunately, I'm very healthy now. I'm 80 pounds lighter. I'm not trying to brag about it. I'm just saying that a lot of these things can be turned around And like, when is now a good time to start for a lot of us? My other thing, when is now a good time to start with eating better, moving more? But the the taxing aspect of this on quality of life too. So we have to invest at some point, and I choose to do it on the front end. Eat well.
Yeah.
I didn't do it. Didn't wasn't that way for a long time though.
And
Holy cow.
a lot of countries do it well.
Yeah,
I've had a patient who had chronic abdominal pain, just always had some GI issues. We don't know what to do with it in modern medicine in the US. We call it irritable bowel. But what's going on is the microbiome has been altered and the body is struggling with inflammation. The gut is reacting to
sure.
all these foreign things and seed oil derivatives. You want to cook, by the way, with avocado oil and extra virgin olive oil and coconut oil, not vegetable oil and canola oil and these other things that sound natural, but they are not. They are heated up and denatured and added chemical solvent changes their composition. The body reacts to them. That's like 10 to 20% of US calories now are these cheap byproducts of seed oils. But
Yeah.
this patient went over to, we couldn't figure out what's going on. I tried some probiotics, and so the patient did not get better. Patient goes to spend a summer in Italy and is suddenly
Oh,
cured, feels great. They come back to the United States and they're sick again. So maybe we need to talk about our school lunch programs, not just putting every kid on Ozempic, right?
seriously.
We take this flour and this wheat and we chop it up and we strip it of its fiber, chop it up. It's processed flour. It's sugar. It's acting like sugar. It's chopped up and stripped of fiber so much it acts and functions like sugar. And we give these kids a sugar high and then they have trouble paying attention. We put them on meds. We're going down a very dangerous path in the United States. 20% of children are on medications. That's not a good indicator of the health of our country. Who's working on this stuff? We can't just keep going down this path of medicating every problem. We need to talk about school lunch programs. We need to talk about treating high blood pressure by addressing sleep quality that increases vascular muscle tone, not just putting everybody on an antihypertensives like a reflex. We
Mhm.
need to talk about treating more back pain with ice and physical therapy, not just surgery and opioids. We need to talk about treating uh, more people who have uh, irritable bowel syndromes with changing their diet. And maybe we
Sure.
need to talk more about environmental exposures that cause cancer, not just the chemo to treat it. We've got to talk about food as medicine, general body inflammation, and our poison food supply.
Oh, I couldn't agree more. There's a thing, I'll just say this before we go to break. I went back to um, school when I was 51. So it's 2012, SU, Syracuse University. And I did the nutrition program. The only problem is they were still teaching the food pyramid.
Yeah,
So, I've learned more past 40 minutes about food than I did in school. I don't mean that bad. SU has a lot of great programs. It's just, and I did learn some really good things. But even the educational aspect, the
yeah.
dietary plans that I see coming in here for people with nutritionists and dietitians, and sometimes it's just a joke.
It's a
So,
joke. It's
yeah.
written by the
So
food
with that
industry.
said, we're going to head out to a last break for this hour. We are with Dr. Marty Makary talking about his brand new book, Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. We'll be back after this short break. Okay, we're back. My guest, Dr. Marty Makary, is works out of Johns Hopkins University. We're talking about his new book, and I want to ask you about this hormone therapy because we've only talked about it once on this show, and just in minor detail, I would love to learn more about this, Doctor.
So, hormone replacement therapy. Let's talk about hormone therapy for postmenopausal women. That is, when women go through menopause in their late 40s or 50s.
Sure.
Their body stops making estradiol, and you can replace that hormone with exogenous estradiol through a patch or a pill or a sticker or something like that. There's many gel, there's different forms of it. So doctors have been giving the replacing this hormone with incredible benefits. They have seen it work like a miracle for nearly half a century. The health benefits are overwhelming. It not just alleviates the symptoms of menopause, but it has long-term health benefits. Women live 3.5 years longer on average. But tragically, this therapy came to a screeching halt 22 years ago when a doctor from the NIH declared in a press conference that he held that hormone therapy causes breast cancer. And he cited a study which was the largest study ever done, the largest clinical trial. It was a $1 billion taxpayer funded study called the Women's Health Initiative. He did not release his data, though, when he made the announcement. The media ran with the headlines. Women were scared and they flushed their estrogen pills down the toilet. And doctors had lists of everyone on in their panel who they see and called them and said, hey, you got to stop this. This causes breast cancer. It was a massive emergency and it was a fiasco. It was a disaster because it turns out when that data finally became public from that researcher, if you look deep in the table, there was no statistically significant difference in the
Wow.
rate of breast cancer. Now,
Wow.
hardly anyone noticed. To this day, 80% of doctors still believe that it causes breast cancer and refuse or are reluctant to prescribe this amazing therapy for women that go through menopause. A woman's more likely to get an antidepressant than they are estrogen for menopausal symptoms today. And just to give you a sense, Carl, as to the magnitude of the long-term health benefits, not just alleviating the mood swings, night sweats, brain fog, weight gain of menopause, but let's talk about long-term health outcomes. It cuts the rate of fatal heart attacks in half in some very impressive large studies. It reduces cognitive decline by 50 to 60%,
Mhm.
reduces the risk of Alzheimer's by 35%. And if a woman falls or is in a car accident, they're far less likely to break a bone. Their bones are stronger. They're more
Mhm.
resilient. They're far less likely to have a hip fracture later in life. There's probably no medication that has improve the health outcomes of a population more or could improve the health outcomes of a population more than hormone replacement therapy started within 10 years of menopause. But tragically, 50 million women in the last 22 years have been denied this therapy, including my mom, because of the dogma that it causes breast cancer, which tragically many people still believe, which is why I wrote about it in this book.
Yeah. Well, I have to say, so this is a little out of my wheelhouse to speak on. I'm not an expert, but I know just enough that estrogen does play a role in bone density, right? We have a unique situation here at my clinic. We have a machine, which is called biodensity. Biodensity is the original bone density builder machine through max force osteogenic, I should say osteogenic max force loading and these isometric contractions. Now, we know that statistically, people age 65 and up, and I'm not sure the real data because I've seen so many things. I don't know if it's 30%, 50%. If they fall and break a hip or a femur, 1 year later, one study says 30% are deceased, one says 50% are deceased. All we know is it's not a good thing. Their fragility score is higher. Fall risk is higher because a lot of times they have decreased muscle mass from sarcopenia or just, you know, as Dr. Michael Joyner says at Mayo Clinic, obligatory aging muscle decay. And so we're at a higher fall risk, high fracture risk. We break the bone, we go to the hospital, maybe we never come out. And for those who are still alive 1 year later, they're not moving as well as they did most times before they fell down. And then when you look back in their histories, we're seeing all kinds of medications that might have wreaked havoc with bone density and caused bone density to decrease. So
Yeah.
that's another thing. When we look at the aging population, I'm 63. So, um, I need to keep working out. I need to build and maintain this muscle because I don't want to fall, break anything, and be a burden to anybody.
Yeah.
But the doctors are not, generally speaking, they're not on board with this, and they don't believe we can improve bone density. And I'm talking without estrogen. I don't prescribe anything. But imagine what would happen if we had that prescription. And then they come and see me because DEXA scans are improving significantly. It might take 9 months or a year, but you didn't get this way overnight, so you don't get the bone density back overnight.
Yeah.
But it is possible to turn a lot of things around. So what would you recommend for, let's talk about women at the moment, but men are affected too in their own ways. What would you recommend for, let's say, a woman in menopause or postmenopause? How should they approach their doctor about these things? How should they bring it up and bring up this subject? What should they ask for?
Well, first of all, you're so right about bones. Bone strength matters. It is one of the important factors in the second 50 years of one's life
Oh, man,
is bone strength. And you can take all the vitamin D and calcium in the world after menopause. If a woman after menopause does not have estrogen in their system, it will not matter how much calcium and vitamin D you take for your bone strength.
mhm.
And yet, this is sort of this dogma that we have in medicine, just like, oh, get millions of bone scans and just tell them to take more and more calcium, more and more vitamin D. Well, they need estrogen. Now, the vast majority of women are great candidates for hormone replacement. I mean, just already in doing the research for this book, where I went back and interviewed the guy, and he's never really done an interview in this way before, but I interviewed the guy who made the declaration, the announcement that hormone therapy causes breast cancer. And in a long interview, he basically, and I go through all this in the book Blind Spots, he acknowledges to me that his study never found an increase in breast cancer mortality. Amazing. Amazing. Because when you talk to 80% of doctors today who say, I don't prescribe it, it causes breast cancer, I don't want to run the risk, and you ask them why, where they get that from, they will cite this guy's study. And he
Yeah.
acknowledged to me that it did cause breast. So, what should a woman do? Find a doctor who's open minded about this. There are lots of doctors now who are enlightened on this topic. You can hand them my book and tell them to read chapter 2, titled
Yeah.
OMG HRT. It is incredible, these benefits. Now, some women are not candidates for hormone replacement if they have a history of blood clots or
Mhm.
they have endometriosis and can get endometrial bleeding. Um, and some women don't tolerate it; they get headaches. But that's a small fraction of women who will not be candidates or candidates for the standard dosing.
Sure.
So that's why you want to talk to a doctor, and it's important for a doctor to manage it. It's not just call it in, get a friend to call it in. You want a doctor to follow and manage it.
Beautiful. Great advice. Well, Dr. Makary, we're coming to the end of this last hour, the first hour here, the last segment. So, listeners, please stay tuned because we do have another hour coming up. Depending upon where you're listening, it'll be either in the next hour or next week. Okay. But I want to thank you for being with me. We'll continue with more about your new book, Blind Spots: When Medicine Gets It Wrong, What It Means for Our Health. Thanks for joining me.
Great to be with you, Carl.
All right. And we'll be back with more with Dr. Makary. All right. Welcome. Welcome. And you're listening to Your Health Matters. My name is Carl Sterling. We are doing a second hour here with my special guest, Dr. Marty Makary. His new book is called Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. This is a true masterpiece. This is something that all of us should be reading because the education in this book is going to teach us so much about what's going on in the medical world, in the insurance world. It's going to talk about how to, let's say, increase your health span within your lifespan, maybe you can introduce this book to your doctor, your doctors, and maybe they'll take heed and take notice that, oh, wow, man, I've been thinking these things too, but I was afraid to ask anybody. Who knows what can happen? But I urge everybody to go get the book, and it is on my website, carlsterling.com. That's Carl with a K. Just go to the book of the week, and you're going to see it up there. So, Dr. Makary, it's been really great to talking with you and learning from you. And I'm so happy that your book is climbing up the charts so quickly. You're right near the top, man. This is good.
It's great to talk with you, Carl.
Uh, I have a question to ask you about. I want to go back to this peanut allergy thing
Oh yeah.
because I was listening to another interview you did talking about peanut allergies, and I'll just let you talk about it. Enlighten us, please. This is
Well,
really interesting.
it's amazing, the research I do for the book Blind Spots opened my eyes a lot about medical dogma. We have the worst peanut allergy epidemic in the world in the United States, and there's a reason for that. It's not genetic. There are no peanut allergies in Africa and many parts of Europe and Southeast Asia. What's going on? There were no peanut allergies just one living generation ago, or at least they were in the United States rare and mild when they occurred. Now they're common and severe, including severe anaphylaxis.
Mhm.
Um, well, the modern day peanut allergy epidemic was ignited in the year 2000 by the American Academy of Pediatrics ordering parents to avoid all peanut butter and peanut related products for children ages 0 through 3. That peanut abstinence created immune sensitivities. The geniuses at the top ignored a basic principle that had been around in immunology called immune tolerance, or the dirt theory, parents had known it as. When you're exposed to things in the first few years
Mhm.
of life as your immune system's developing, your body recognizes them later and is far less likely to see them as foreign. So we watched peanut allergies skyrocket in the first few years after this dogma that all young children should avoid peanut products. And so what did the medical establishment do? Did they say, we should have had a study before we made that recommendation, or we should have consulted with immunologists, or maybe we got this wrong? No, they said, well, the problem here is parents are not compliant with our guideline. We need to double down and get more of these anti-science moms to make sure they have peanut abstinence for their children. Well, guess what? It just got worse and worse and worse. And when the one kid couldn't be around peanuts, or one kid developed a peanut allergy, then the other kids in the home or school could not be around peanuts, and they got sensitive. And this became a self-licking ice cream cone, and it skyrocketed. And now we deal with this terrible plague of a peanut allergy epidemic where it's real. People can stop breathing, have trouble breathing, kids just being near a peanut.
They don't
And
even hand them out on airplanes anymore.
airplanes, schools. I mean, one school, Parkway School outside of St. Louis, they have 1,000 kids in the school district with a peanut allergy. Many
Oh my
are,
gosh.
yeah. So this is a manufactured epidemic. Peanut allergies existed before the year 2000, but they were rare and mild. And a prior generation didn't see it. And you still don't see it in most parts of the world. But in the United States, this dogma of peanut abstinence finally got tested with a proper study just 8 years ago. And they realized they got it perfectly backwards. But you didn't see a big apology. They just kind of faded out. And I write this book because people need to know the truth about so many of these big health topics today.
Mhm.
Um, it's not just peanut allergies. They didn't apologize for the food pyramid. They got that wrong for 70 years. Saying opioids were not addictive, that was a medical establishment dogma. Medical societies embraced that, silencing doctors who said, no, it is addictive. Well, that dogma ignited the opioid crisis that we still deal with today. The overuse of antibiotics has altered the gut bacteria of a generation. There are so many things in modern medicine where I still deal with medical dogma from either the last 20 years when we put it out there with so much absolutism, but the reality was it was just an opinion. of a small group of doctors at the top.
Yeah.
Um, we need to encourage a civil discourse. We need to encourage doctors to think creatively, individualized care. We have the sickest population in the history of the world and the most medicated. We need new ideas. We need fresh, big ideas. You can't do that when everybody's focused on billing and coding in short visits. So we need a fresh, new approach, and we have to look at our blind spots in medicine.
Yeah. So I'm wondering if we look at this and from a 40,000 foot view, let's say, and we're just looking top down, what are the drivers here? So I'm just going to speculate for a moment. And please jump in and correct me if I'm off base at all. It would seem as if big pharma plays a role to some degree, that maybe corporate entities, I know my son who's worked in hospitals here and there, some of these hospitals are being bought up by corporations, and then it becomes a numbers game. It's all about profit more than it is health outcomes. It's about let's make the money, let's bill, let's get the money, let's get them in, let's get them out, let's take the money. I don't know if pharma and that works together, pharma and insurance, medical system works together, but I guess what I'm trying to say is doctors are under a lot of pressure, it seems. And for those who, well, like yourself, you're standing up and you're writing a book about it. And once in a while, I just lose my train of thought, and I just did it. But I know where I want to go with it is how are the three things working together?
Yeah.
How are the three things? Pharma, insurance, medical.
Well, I think in healthcare, everyone is so busy billing and coding and paying each other and looking at their own, profit and
Yeah.
loss sheets that no one's thinking about health. No one's looking at this population that is sick. Half of our nation's children obese or
Yeah.
overweight, diabetes on the rise, autoimmune diseases, autism, cancer rates doubling, peanut allergies are epidemic. Who is actually looking at these root causes? Is pharma going to fund research that does not promote a pharma product? No, and they have a hammerlock on American research, and they've captured our regulatory agencies. So I don't think it's a diabolical thing. I think it's just somebody in our giant healthcare system has to stop putting their head down, look up, and say, what's going on here? We've got to take a new approach. We can't just medicate the world to death. We're not going down a good path. We need big ideas, fresh ideas. We need Ben Franklin thinkers. We need the NIH to start funding research on food as medicine, not just bat coronavirus research in Wuhan, China.
Uh, yeah, I hear you, man. Okay, we're going to go out to a break. We'll be back with Dr. Marty Makary in just a couple of minutes. Okay, we're back. We're talking with Dr. Marty Makary. Doctor, I'm curious to know, I see this a lot as a non physician. I'm not a doctor, but I hear stories. People come in, they work out with us in our clinic, do our exercises, and we hear about treatments they've had, procedures they've had many times, which seem to be, first of all, they're not helpful. The outcome is bad. Not always, but plenty of times when they're bad. And it just leads me to believe there's an over treatment, let's say, and there are unnecessary procedures that are more commonplace these days. Please talk to us about this.
So we have two problems in healthcare. One is overtreatment and the other is undertreatment. But by far, overtreatment dominates the marketplace right now. We see the mass overuse of safe procedures, things that have very low complication rates. We see abuse go way up with some of those. And I think
Okay.
we almost convince ourselves as physicians that, you know what, I found a concerning polyp in a 20-year-old once. Maybe we should be doing colonoscopy on every 20-year-old in America. And that becomes, we almost convince ourselves. And so what happens is we have a system that promotes tests and procedures. So when we asked 2,000 doctors in a national survey that I conducted out of Johns Hopkins, what percent of medical care is unnecessary, in your opinion, as a physician, excluding your own practice, looking at what's around you? And they said 21%. It was higher for tests and diagnostics, high for medications, and lower for procedures. It was about 11% of procedures. But when you have people on the front lines of any industry telling you that 1 in 5 things that they're doing are unnecessary, there is a tremendous opportunity to increase the appropriateness, change the
Mhm.
financial model, improve quality by cutting the waste in the system. And that's what we are trying to talk to Medicare about and insurance companies about. I work with insurance companies. I've worked with the Medicaid folks in the state of New York, with um, groups in Tennessee, Highland Physicians, Ballad Health, insurance companies. We work with them on looking at how their doctors perform on appropriateness measures
Mhm.
and then using that data internally for quality improvement. So that's where things are. That's what people need to know about. It's good to get a second opinion sometimes. You're going to
I'm
have,
glad you said that too, because I have that written down here as second opinions. I was going to ask you about that. And
yeah.
we've had a few people who've gotten second opinions, and I'm really glad they did, and so are they. I have to just go off for one moment and say that many of the people we work with, they live with Parkinson's disease. That's the work, if you will. And you don't know me. I'm not bragging. I'm not trying to impress anybody. I just happen to have traveled all over the world, written a couple books on it, disease management, managing disease symptoms, slowing disease progression, people living with Parkinson's. So that's what people come to me for more than anything. However, one of the more interesting things I see, sadly, are those who are diagnosed with Parkinson's who do not have Parkinson's. This is where the second opinion comes in, maybe a third opinion. Now, as I said before, and I'll repeat it, I am not a doctor. In case you're just tuning in, I'm not a doctor. However, I've been around thousands of people, and if somebody says I have Parkinson's, they don't exhibit a single motor symptom or non-motor symptom. I have to question, do they have Parkinson's? Did they have any imaging done? Did they have a DET scan? And not that that's the end all be all, but it can be maybe one of the better tests. Did they do any testing? A lot of times what happens is doctor says, just looks at them. Maybe they walk down the hall, come back, do this with their hands, touch their nose. Okay, you have Parkinson's. I don't want to judge because a lot of
Yeah.
doctors are great and they're fantastic and they're right, except for when they're wrong. The ones who tend to do that more, we send for a second opinion. Boom, DAT scan, no Parkinson's. What can we do about this?
Yeah.
Of course, there's the reverse too, where they're not diagnosed with it and they definitely have it and they've had it for literally one person I know, 17 years, finally getting a diagnosis. So it's both sides of that coin.
Yeah.
What do you think about that?
And with children, I was talking to a psychiatrist, and he was saying that so many kids are being diagnosed with all these mood disorders and with attention deficit disorder.
Yeah.
And he said maybe the kids are not, uh, there's nothing wrong with these kids. Maybe we've asked them to get up very early, sort of breaking their circadian rhythm. We put them under fluorescent lights. We had tell them to sit down sedentary at a desk and not move for 7 hours a day. And maybe the kids aren't made for that. Maybe that's not normal. Maybe we've applied this construct, and if they're not following what adults have imposed on them, we call them, we give them a medical disease. We diagnose them and medicate them. So we are seeing schools now start to change to say, look, let's let kids be kids and let's try to change the school so we don't have to medicate as many people. And so we live in an era where there are real mood disorders, real psychiatric conditions. There are people with real Parkinson's, real Alzheimer's, real Lyme disease.
Oh,
But we
yeah.
also live in an era of the medicalization of ordinary life. And so people need to recognize that the system is not really good at identifying the appropriateness of care as on whole. Now, individual physicians, you'll find superb physicians, like the psychiatrist I was talking to. He's trying to get kids off their medications. And he says sometimes the parents are so scared to get the kid off. Now, my
Yeah.
colleague is a genius. He's a Johns Hopkins trained child psychiatrist, and he deals with parents who will not be willing to wean their kids off these ADHD meds because a school psychologist told them they have to be on them. And if they don't, they're going to go wild. Well, sometimes we need to take a step back and ask, what are we doing? We got the most over medicated population in the history of the world. We can't keep going down this route.
Yeah, before we go to break, I just have a comment about that. There is a member of my family, um, who's I think 9 years old, who is just the child from hell, if you will. I don't know if I could say that on the radio, but I just did. So they cleaned up it. They took the sugar out of his diet, the gluten, the process, all the process. Let's put it that way, sugar and
Yeah.
processed stuff. This kid is a different human being. This kid is no longer, when you said go wild, this kid was wild, out of control. Guess what? This kid is the nicest kid when he eats well. But give him a candy bar, give him the sugar, and forget about it. It's horrible.
It's amazing what
Um,
happens when we poison the food supply and give it to kids.
sure, and then we need a drug to fix it, and then everything's all messed up, and it just the spiral downward continues. Folks, we're going to take a break here. We're with Dr. Marty Makary. We're talking about blind spots, his new book called Blind Spots, an amazing book. Thanks for listening. We'll be back after this short message. We're back. All right. So this has been a really fun conversation. I appreciate you joining me, Doctor. Thank you
Yeah.
so much.
Enjoying it.
So interesting. Yeah, me too. My son's an MD. He told me that he took one class on nutrition, first year of med school, first semester. And that was it. So, as seems to be the case, and I think he actually got more education in nutrition than a lot of medical students do, but it wasn't enough. And I wonder if you could speak to us a little bit about the education that doctors are receiving in medical school, and what is it like, and what should we be doing about it, or what should educational institutions be doing?
Well, medical education is a joke in America. It's control. Every medical school curricula is controlled by one private company with a board. So
Hmm.
imagine every college was teaching a curricula controlled by one private company. A small group of people decide what every college teaches. You would never innovate. So if a medical school wants to teach something different or creative, or they want to teach certain types of skills, all the exams are written by this one central private company. So they really struggle. I was just talking to a medical student. A friend of mine graduated from Oklahoma University Medical School, got 2 hours of nutrition education, 2 hours of formal nutrition education. What's worse is that when I asked him what they were teaching in those 2 hours, it was misinformation. It was the old government food pyramid. It's
Hmm.
the industry funded experts. Even the Food Compass, which the NIH just funded a giant project on health and nutrition to come up with, what's actually healthy and what's not. This is a massive taxpayer funded effort by the NIH. It concluded that Lucky Charms is healthier than a steak. It had so many weird conclusions that violate all these principles I write about in Blind Spots, these big issues we're not talking about. So it probably would have been better for him to have 0 hours of nutrition in med school because it was wrong information. And so what does it tell you that so many medical students, like my friend Will Brune, so many doctors now are getting their education not from the medical community, but from smart doctors who have done deep dives into the research on food and health and nutrition. Dr. Mark Hyman, Dr. Peter Attia. I know you had Casey Means on.
Hmm.
I'm trying to get the word out in the book Blind Spots, also in a chapter that talks about what we should be eating and are eggs really bad for you?
Hmm.
Turns out eggs are one of the most healthy, nutritious things we could eat. Good,
Good.
healthy eggs. It's rich in protein.
I'm so
And
happy about this.
you like eggs, and me
Yeah, I
too.
do.
Um, but the medical community demonized eggs and natural fat and cholesterol. It turns out the great irony is that when people avoid cholesterol, it makes no sense. The cholesterol you eat does not even get absorbed by your body. 90% of it goes right through you. And so cholesterol in the diet is esterified. It has a bulky side chain, so you don't absorb the vast majority of it. Cholesterol in your body is made by your body. It's
Hmm.
manufactured by your body. So we've done a terrible thing to the public. We've put them on this mission, on this warpath of looking for cholesterol and avoiding it in the diet. It is a crazy thing we've done. Even the demonization of natural saturated fats, a dogma that started in the 1960s by one guy named Dr. Ansel Keys, that dogma lives on today,
Wow.
even though it's been proven wrong with three giant studies. At least three giant studies tried to prove an association between fat in the diet and heart disease, and all three studies failed to show that. I go through all this in my book, Blind Spots. Yet, dietitians and nutritionists will still tell me, yeah, it's good to avoid fat. Um, we have low fat milk in schools that ironically take out the natural fat and add sugar. And this
Yeah. Good.
intense focus on fat resulted in us missing the fact that refined carbohydrates, including added sugar, drive general body inflammation and make us sick. And when you add all the other chemicals and ingredients in food, we have an ultra processed poison food supply that we have ignored in our blind spot because we've been on this warpath to tell people to avoid saturated fat and cholesterol. It is a great irony. And
Wow. Yeah.
yeah, so anyway, I was
It's all
just going
just
to,
mind-boggling to me. When I was a kid, so let's say 50 years ago, I'm 13 years old, and people who listen, they've heard me say this before, but we didn't have, what was I, eighth grade then? Yeah, eighth grade when I'm 13. We had a couple obese kids, a few overweight. The class was about 185, not too big, but not super small. We didn't have all these allergies, insulin problems. Diabetes was very rare. I mean, going way back in time, if somebody had diabetes, they people were doing a case study on it. This is like a special research project because, oh my gosh, there's somebody with diabetes. And I say this not in a disrespectful way. I really am concerned that it seems that, I mean, I know people personally who they're diagnosed pre-diabetic, or then they get into maybe diabetes, and they're, well, okay, I mean, at least we can manage it, and this is normal now. It was never supposed to be normal, and that's very, 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 very sad to me. We should not be accepting diabetes as the norm.
we've got a third of the population has something called steatohepatosis or NAFLD. It's when fat moves into the liver because there's no place for it and the body puts it into storage.
Yeah.
And then it pushes out, it crowds out the healthy liver cells. Remember, the liver is maybe one of the most important laboratories in the body. It's where everything happens. So we're damaging the liver of a huge segment of the population. No one talks about it. And then we see them in late stages. And then we wonder, why do we have the most expensive healthcare system in the country? We've got to start talking about food. If the medical establishment would take 5% of the enthusiasm they have for giving a newborn baby a hepatitis B vaccine upon birth,
Mhm.
even though that's an infection you get that's sexually transmitted or from IV drug use. That's the only way you get it. If they took a fraction of that enthusiasm to insist that every newborn baby gets a hepatitis B vaccine and talked about our poison food supply, we do a lot better in promoting public health.
Absolutely. Absolutely. And just for those who are listening, I'll make sure that you heard the uh NAFLD, right? Non-alcohol fatty liver disease. Just for those who may not have known what that is. Well, I dealt with that after I stopped drinking. Of course, when I was obese and drinking, my liver was really messed up. The numbers were horrible. But the good news is for 3 years in a row now, it's been perfect. And just a side note here before we go to break, and then we have one more segment coming up. Don't you know, after I get my numbers right, I get hepatitis A when I go to Mexico. Well, you know what that does to your liver? It's not good, but at least that got fixed too. So, anyways, folks, we'll be back after this short break. We're with Dr. Marty Makary, and this has just been so enlightening. Thank you, doctor. We'll be right back. All right, we are back with Dr. Marty Makary. This book is really amazing, folks. Really urge you to go pick it up. It's well, of course, it's called Blind Spots. And we need to go, we need to talk about a couple things here I think are really important. So we're going to get into one element here that I think would be very, very helpful. And that is what kind of testing can be done. For example, blood tests. There must be some kind of blood test people can have done.
There's a couple common blood tests that everybody should get done that are not routinely done. So next time you get blood work, I recommend you add a lipoprotein A, or what we call LP little a,
Hmm.
and apolipoprotein B, or what we call ApoB.
Hmm.
Those are two very powerful predictors of early heart disease. When somebody has a heart attack, surprisingly in their 40s or 50s, and we go back and get a blood test, it turns out we'll sometimes see that their LP little a or ApoB was elevated. And lipoprotein A, these, by the way, these are the subtypes of lipoproteins that embed in an inflamed artery. So inflammation causes heart disease. That's the primary mechanism. But once the blood vessel's inflamed, it's these small, dense lipoproteins that deposit and cause plaques. So you really need both to have heart disease. And that's why we want people to live healthy, have good gut health, to reduce inflammation, eat whole foods, clean meats, meditation, fasting. These are all biblical principles that we're rediscovering in modern medicine. Live a healthy life to keep your inflammation low. And then your body genetically is sort of programmed to make lipoprotein A in higher low numbers. It's good to know because if it's high, you can maybe be a candidate for more aggressive therapy and monitoring. And then I always recommend a fasting insulin and fasting glucose levels. I get liver function tests, but those are, the primary care doctors are good at ordering some tests, but those tests may not be routine. It are fasting insulin, fasting glucose, and then the cardiac test, lipoprotein A and ApoB. And so there's a lot, obviously, we could go into a lot of detail, but those are some general screening blood tests that I think everybody should be getting.
Okay. Yeah, that's very, very helpful. One of the things my son uh, enlightened me with is just this thought. So I've actually used this. He was saying a couple weeks ago, and I've said this on air before. These tests can reveal things. Maybe we're fine. That would be nice. Okay, good. I'm fine. But what if you're not? What if there's something that can be done to help make us healthier, live longer, live better? But the thing that he said that's really, I never thought of this. What if we could feel every m- minute thing that's going wrong with us? What if the dying cells, the this and the that, the struggling mitochondria, the struggling cells, what if we could feel these, actually physically feel them struggling? Our behaviors would probably change a whole lot because we wouldn't like how we feel. But just because we can't feel something doesn't mean we're okay. And I think that's a good point to emphasize because I've been there. Oh, I feel fine. Oh man, my liver is so whacked out.
Yeah. Yes.
I mean, it was scary at one point, but I felt fine, I guess. I mean, I feel way better now. How about this group think psychology? Let's talk about that.
Yeah, the low fat diet. I remember talking to one of the authors who wrote the food pyramid guidelines for the government. when I was doing the research for the book Blind Spots. And I described the interview, and she basically suggests, wait a minute, are you suggesting that everybody is wrong on the low fat diet? That the Surgeon General's wrong, the American Heart Association's wrong, and she just listed all these authorities in medicine. And I said, yes. I'm just asking, is there any research that's scientifically valid to support this food pyramid and the low fat diet? And she was just so blown away that, Marty, all of these people believe in it, therefore it must be truth. But a consensus is not scientific evidence. And we can have medical experts lock arms and walk off a cliff together. And it's happened. We saw with peanut allergies, opioids are not addictive, denying women hormone therapy, the low fat diet, antibiotics won't hurt you. So much of the dogma that I go through in the book, where I try to educate people about the actual scientific truth, there's a group think. And it's not because people are bad, it's because there's a whole psychology to just believing what we hear first, not because it's more logical, but simply because it's settled in the brain first. And the famous psychologist Leon Festinger, who came up with the term cognitive dissonance or discomfort, he was talking about how when an idea gets settled in our brains as a part of the human condition, we don't want to let go of it. We're satisfied. Things are calm and peaceful in our brain. And when we hear new information that contradicts it, even if the new information is more accurate or logical, we don't want that discomfort. So subconsciously, without even realizing it, we tend to reject new information that conflicts with what we already believe, or we'll reframe the new information to make it fit what we already believe. Let's say you're a smoker and you hear a study comes out showing that smoking is bad for you. You might naturally just, without even realizing it, reframe the new information to say, well, that study was done in a different group of people, or they weren't like me, or I don't smoke as much as them, or I use filtered cigarettes, or whatever. You'll go through whatever acrobatics you need to do to try to change the new information to make it fit what you already believe. And we do that all the time. We do it in politics. And I've realized in doing the research on cognitive dissonance that I talk about in the book, that I have this tendency. We all have it as part of the human condition. And the father of modern medicine, Claude Bernard, was talking about this when he said we have to all recognize that we have biases. That's normal. That's part of our life experience. But we have to actively recognize those biases and then actively suspend those biases temporarily as we consider new information in order to be impeccably objective.
I think that's one of the best messages I've ever heard delivered. Because looking back, I can use myself for an example. I was absolutely positive because I had longevity on both sides of the family, and they all drank their butts off. That if I continued to drink, I would be okay because they were okay. Well, they weren't okay. They actually weren't okay at all. Their health span was not good within their lifespan. But I didn't think of it back then like that. I had my own bias. So I just had a little, if pardon the phrase, if I shouldn't be saying, a little come to Jesus meeting. Come on, Carl, get your act together. Just don't be stupid anymore. And the wake up call was real, and life is a lot better now. Um, Doctor, I can't even thank you enough for joining us today. This has been a real pleasure, real honor to talk with you. I'm so excited for your book. I want to get it out to as many people as possible. This is a game changer. You're doing such great work. You are going to change the world.
Thank you. Thank you,
You're
Carl.
doing this. You're doing this with the education. You're doing this with the book. I just hope everybody gets their hands on it at some point to get those eyes open, get that wake up call, because this can change the world if enough people, and especially in the right positions, act upon it, overhaul the system. So you're doing great work. Thank you.
Thank you, Carl. It's been good talking with you, and I'm glad you found the book interesting and educational. But um, more more of a compliment was what you said, that you enjoyed the book as a read. So that
Oh,
was my
it's
goal, is
great.
to make it enjoyable as a read so
And
that you
and
don't get
um
depressed.
you also write the way you talk. It's like I could hear your voice through the words, and I actually love that. I just love that.
Great. Thank you.
Well, again, people, go buy the book. Okay, it's called Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health by Dr. Marty Makary. Thank you, doctor. Thank you, everybody, for listening. Really appreciate you listening to the show. And remember to keep moving, eat good food, use your brain, move your body every single day. Have a fantastic week.